As a therapist, what relationships do you look at when it comes to understanding the client's difficulty? That has a very special relationship to the presenting problem. More about that in the upcoming episode. Welcome to The Art of Therapy, Season 2, Episode 3.
I'm so excited to be back here with you in our studio and really just diving deeper and deeper into the art of therapy.
Yes, I'm really glad to be it. You and I are starting to really unpack the how of therapy. And therapy really is an art.
It really
Yeah.
is an art.
Uh,
Mhm. So go back to just to give a quick summary of where we left it off last time. So with our previous episode, we really had a look at the importance of really listening to a client and understanding their difficulty or their problem from their frame of reference. And what a therapeutic relief that can be for them already, in just for someone to really understand them and how they see their problem. But then also the second part to that is really being able to understand what causes the difficulty that someone sits with, and having a look at what do we observe, the observable behavior of what causes it. And it moves it to from the intrapsychic to the interpsychic perspective. But then so also with that is in relationship and how it creates circularity with that.
Beautiful, yes.
Yes.
Yeah, what I would note there is that you highlighted it so clearly that just through the client being able to share their experience and our active listening and accurate listening of them is therapeutic in and of itself. And then through them being able to share and talk about the problem, then from a diagnostic point of view, we can really note carefully the problem as they see it, describe it, document it, and that's going to be really important, as we know, for diagnosis. And then, of course, that we begin to connect that causally as to what could be causing their difficulty and their experience of this, and that we really look at interaction and the patterns of interaction.
It's really bringing it together and understanding from their frame, and really with regard to the diagnosis as well.
Yes.
Mm, mm, mm. So then the question still remains, what do we observe?
So we seem to be back at it
Mm,
in terms of what we observe. And I won't defer this for too long. I want to just look at something that I think is so important for the way in which we're working and describing and making sense of therapy. And that is that already we are working and looking at this integratively. Because if we just take the person-centered approach, we know already what that means from creating an environment with unconditional positive regard, communicating very congruently, and where there's no judgment. What that can mean therapeutically for a client and their capacity then to self-actualize, which is amazing. Now, we don't just have to limit ourselves. That's working within the person-centered approach, but working integratively, we now consider, well, the way in which someone is relating in a relatively non-directive relationship, perhaps that way of relating is going to be something that connects with what it is they're having difficulty with. So already we're beginning to work integratively. We've taken the person-centered approach, looked at it therapeutically, but now considering what could that mean for the process of diagnosis. And then adding to that, once we begin to look at the communication theory and beginning to consider then uh, in terms of impact and what is communicated and how we have impacts on one another, which is circular. And now we're utilizing the communication approach, but utilizing it too with our understanding of systems and circular causality. So it's beautiful already how we're beginning to work integratively, what that enables us to see as therapists, and how we can understand the therapeutic process more broadly.
It really is combining all three of those aspects and creating almost like a bigger lens that you can look through, which gives you more and more information.
Yes. As I think you've again looked at it so clearly that if you've got one lens, you're going to see something meaningful, but the lens will limit what is possible to see. But when you use another kind of lens and another, each time you add a lens, you're making sense of the phenomenon and what you're observing much more broadly and much more comprehensively. So that's the beauty of an integrative approach. So I wanted to note that, because where we're going now is back to your question of, well, okay, having said this, and we're going to observe patterns of interaction that in some way perhaps relate to the presenting problem. Well, having said that, exactly what do we look at? And so, well, working integratively, what we're going to be looking at is something, it's a phenomenal understanding and a sharing. And with some of the work again of Professor Charl Vorster, he applied himself to the problem of, if we're going to observe interaction and pattern of interaction, what do we look at? Which relationships? Because each one of us exists in a system. We exist in our family, our primary system, and we have any number of relationships in that system, in our family system, but we also have work systems where we relate meaningfully and have interactions. We have friend interactions and relationships. So where do we actually look? And this is what he began to consider. What helps us to determine where to look? And what he visited was some profound work by Gregory Bateson in the last century, where Gregory Bateson and Ruesch, we touched on that in one of the earlier podcasts, our first series, where Ruesch and Bateson did amazing work on the communication approach. But a founding principle there for both communication theory and ultimately what is understood and utilized in systems approach too, which was Gregory Bateson's contribution, was the notion of context, that context determines the meaning of behavior. And so when it comes to communication, no communication is wrong or right. No behavior is wrong or right, good or bad. All behavior has communication value, and its value depends on the context. So context determines the meaning of behavior. And Charl then had considered this, and then considered, well, if context determines the meaning of behavior, what if the presenting problem and the client's difficulty serves as the context for understanding what relationships to look at in the client's system? And that was a very key observation, because now that we consider this, of course, it's likely and we can expect that what a client is having difficulty with is going to relate to their relationships. And if we pay careful attention to that presenting complaint, it's going to help frame where to look. It gives us the context for making sense of and understanding the client's relationships.
Hi, it's Marizaan, and I would like to tell you something extraordinary happening at Treatment Works. So if you are a healthcare professional and you would really like to deepen your therapeutic skills, training with Dr. Phipps is a must. In my experience, his training is so compassionate, it has high clinical excellence, and it makes therapy so clear. Training is also not just a space to learn, but it's also a space to connect, to share with others and learn from others. So if you are ready to deepen your therapeutic skills and to look at more ways to support your client, join us for training at Treatment Works. You're welcome to visit our website at treatmentworks.co.za. it's how you describe it now is that the context determines the meaning of communication, and that actually helps the therapist of where to look at. It reminds me of a training that I had with you earlier, where you described it as really as being a flashlight that a therapist can use in where to point, where to create lights, where to create having an understanding of where the client is at,
Yes.
and that actually helps a therapist then to know where to look.
Yes, very much. And I'm so glad you've noted that, because, yes, that analogy, I think, is a really beautiful description or way of understanding how complex interaction is, and observing interaction and patterns of interaction, and how we can begin to focus in and why in a particular part of that interaction. And so it's very much like a flashlight. It's very much like that torchlight that shows us exactly where do we focus on which relationships. And, I think I've noted, but I'll just clarify it again. We've sometimes joked about this in training, that when one's looking and trying to assist a client, and if the presenting complaint has to do with some difficulty at work and rejection by a colleague, and if that's the presenting problem, one won't necessarily look at something that happened in early childhood, like stubbing, one's toe on something, and having someone nearby. And there was nothing particularly relevant about that other than stubbing one's toe. The reaction from whoever was there, say a parent, was meaningful. But once you understand now that the context for where we're going to be looking relates to the presenting problem, well, that helps us to discern what's going to be relevant, which relationships are relevant, which are not relevant. Not that they're unimportant, but what's relevant and what's not relevant to the presenting problem, the difficulty that the client's experiencing. And suddenly, a vast interaction and numbers of different kinds of interactions that the client's experiencing, we can now begin to look more closely with the flashlight, that torchlight.
Yeah, that's beautiful of actually understanding what, like you said, it's not what's important or not important, but it's about what is relevant to the specific difficulty that a client sits with. Because otherwise, there's so many relationships, so many interactions, so many behaviors. Where do we look at, and how do we assist then? That it can be quite overwhelming.
Yes.
So if we can narrow that down and really focus that, and using that flashlight to determine what's relevant to the presenting complaints, that can actually create a lot of guidance and a lot of perspective of where to start working.
Yes. It's so important, this, because by just understanding the why, we can now understand what relationships for the client to look at. And suddenly, therapy is not so overwhelming, because for many, it can be so overwhelming. Where, as a therapist, where do we start? What's important? Which relationship do we look at, and why? And the moment we understand this, suddenly therapy is not so overwhelming. And it's exciting as to how can we begin to now note the relationship or relationships in those interactions, and how they bear on that presenting difficulty.
So now we know where, but it still remains the question of what.
Right, you never let up. All right. So yes, we've looked at that. What if we're going to look at it in more detail? We now know what relationships to look at and why, because it's going to be those relationships that bear on the presenting problem for the client. But still, you added what then to look at, what to observe. And that relates to something that it has to do with mental well-being and our understanding of that, and how that occurs, and our experience of that relationally. But that's something for another episode.
Sounds good. We'll do that in the next episode.
Yes.
Thank you for joining us on the Art of Therapy today. We hope that you find this conversation really thought-provoking and meaningful. And if any of the aspects really resonates with you, please feel free to leave a comment below. Thank you for walking this journey with us. Until the next episode.